So it's that time of year where things are starting to heat up with the med school application, and I'm just back from a run. I thought I'd quickly make a video to make like a checkpoint for what you should be doing at this stage, because this is the bit where people start to kind of get a bit confused or maybe start to leave things really too late. So if you've heard me do it before, I break the application down into 4 phases, and we have very much finished phase 1 now, which is all about CV building. So at this stage, really, you should have got your work experience either done and sorted and ticked off and like recorded in some sort of log so that you can come back to those things, or you should at the very least have it organized to be executed in summer, so that now you're at a stage where you're not thinking about it. It's just kind of either on autopilot, like, you know, you've got your volunteering or whatever it is, like ticked off and just happening regularly, or you've got it done, or yeah, just in the bank basically. So that's the first thing. Then the next thing is you're probably focusing on exams at the moment, because there's a lot of you know, you're probably doing A levels or you know, uni exams, and that's the main focus, and that's exactly what it should be right now. Exams should be the focus, because whatever I say, like any time people are doing medicine or dentistry application prep, like all of it counts for nothing if you don't get the A level results or the you know, the degree level. So it's really important not to forget that. But really at this stage, if you haven't done any of phase 1, it's going to start to get really difficult. And we're really into phase 2 now, which is where you should be thinking about UCAT prep. Like I say, it's not like people burn out by doing too much too soon. But this stage, whilst you're familiarizing yourself with UCAT stuff, this is where you're kind of like just treating, like understanding the basics of the questions, understanding the format, understanding the types of techniques that you need, and just getting those in your brain, a little bit like the same way you do brain teasers, just for a bit of pastime. But it's important to get that stuff sorted now, because you need to understand what is coming with the UCAT, so that when it comes to actually getting serious about it and really kind of focusing on it, that's when you need to have done this stuff to understand what's ahead of you. So it's really important to do that. And really the final thing I'd say is, if you are one of those people who, you know, haven't started the prep properly yet, you're just doing exams and focusing on those at the moment, I would really strongly encourage you to, as soon as the exams finish, just get on it now, because now is the time. Like, so many people come to us on the predictable offer protocol program that we have, and they really wish they would have started earlier, because the sooner you start, the more you realize just what's involved, and you can be a bit more, you know, methodical, and you can take it a lot more smoothly, which means that people are more relaxed, they've got more time to do stuff, and they just perform better. And that means the difference between getting in and not, or, you know, being eligible for the more competitive medical schools. And that's really important as well. So I'd really strongly urge you to make sure if you're not on it already, you need to start getting on it hard as soon as your exams are over and you can focus fully on it, because you don't want to be the person who is getting to July or yeah, even June really, but some people as late as August, they like realize suddenly like, oh crap, I've got so much to do, and they really come unstuck with that. So yeah, that's my advice to you. You can see this checkpoint that I did back in kind of February, March sort of time. But if you want some help with your application, if you want to understand how to maximize your chances, the new POP, predictable offer protocol, that we released has a 93% success rate. I do a video that shows how we get that 93%. And yeah, if you want to be one of those people, you can apply to join the program, and we'd love to help you on the journey to your chosen university. All right, take care, best of luck with it, and good luck with exams.